Australia is making COVID-19 vaccinations mandatory for aged care workers as outbreaks surface across the country. They must have their first dose by mid-September to be allowed to work. Cases of the more infectious Delta variant have flared in at least 4 cities, and that's prompted tough new measures. Sydney is the current epicentre, where the cluster has grown to 130 cases. Millions of residents have been plunged into a 2-week lockdown. 18 new infections have been confirmed. That's a slight dip from yesterday.
We have to be prepared for the numbers to bounce around, and we also have to be prepared for the numbers to go up considerably, because as experience shows with this strain, we are seeing almost 100% of transmission within households, and we're seeing a very high rate of transmissibility.
Coronavirus cases have also been detected in Brisbane, Darwin and Perth. A 48-hour lockdown in and around Darwin has been extended till Friday as a cluster linked to a gold mine worker grows to 7. That person is suspected to have contracted the virus before flying in from Brisbane. Queensland is now preparing to reimpose curbs as it confirms 3 new cases. Gatherings will be limited and masks made mandatory. Perth has already issued a mask mandate for 3 days. It's warned of a possible lockdown. A resident has tested positive after visiting Sydney more than a week ago. Live now to Danielle Robertson. She's in Sydney for more on this. Danielle, Australia is stepping up testing and vaccinations as the COVID-19 situation there worsens.
Yeah, tonight an emergency National Cabinet meeting was held, led by the Prime Minister Scott Morrison, and that's really to do with the country now dealing with the latest Delta variant and the fact that states and territories are now in lockdown 18 months after the pandemic began. There were a few main points that came out of this emergency meeting tonight. The first one was that aged care workers will now have to get the vaccination. It will be mandatory, and their first dose has to be taken by mid-September. Now, the Commonwealth has rolled out an $11 million package to ensure that does happen. Basically, that package will allow those workers to take a day of leave. That includes casual workers as well as subsequent days off to get the vaccination and any other days to take off if they feel any symptoms. So it's trying to boost vaccinations in that sector. It is also now mandatory for quarantine workers and hotel workers to get the vaccination as well. And that really stems from the latest Sydney lockdown that began really with a limousine driver who worked at the international airport and was transporting people to quarantine, and that's what sparked the lockdown here. So that was a big topic of discussion. There was also another policy put in place that international arrivals and domestic quarantine people who have travelled domestically will be put into a different hotel. So it's really splitting the high risk and the low risk hotels to try and mitigate the potential COVID cases there. Another major announcement was that anyone under the age of 60 can now get the AstraZeneca vaccine, and that's because a new policy has been put forward that gives indemnity to GPs. That basically means that GPs won't be able to be sued if they give the AstraZeneca to anyone under the age of 60. This is all in an aim to now boost vaccinations across the country as people are getting frustrated with the lockdowns here, considering we've now been living with this pandemic for so long.
Meantime, Danielle, has the government indicated any possible shift away from its current zero COVID approach?
Yeah, it was interesting in the National Cabinet meeting. Singapore's approach was actually mentioned there. It was put to the Prime Minister a question about Singapore's strategy out of the pandemic and if we would take on board any of those similar strategies instead of keeping on with these lockdown and restrictions. But the Prime Minister did really point to the fact that Australia has had much more freedoms and less fatalities than other countries, and really pointed to these successes, which really leans towards that there aren't going to be any changes to quarantine and lockdowns anytime soon. He's really hinging on the vaccination rollout. And as we know, that has been a bit of a shambles. The government has fallen short of all of its targets in terms of vaccinations, and and only 4% of the population is vaccinated at the moment. Now, while he pledged that there is going to be more vaccinations coming, he said the current vaccinations are all being rolled out at the minute. That's all the ones that we have for now. So it doesn't seem anything is going to change on the quarantine and lockdown front. That's really going to be our reality for now until more of the population can get vaccinated. And that's what that announcement at the Emergency National Cabinet meeting aimed to do.
Danielle, thank you for that update. Danielle Robertson there in Sydney.